Hi, welcome back to another episode of Bright Eyes Face Medspa. My name is Kaitlyn Roberts. I'm a physician associate aesthetic injector, and I'm here with...
Hi, I'm Tarin Currier. I am a registered nurse and also an aesthetic injector here at the Med Spa today.
Today we are here to talk to you about neurotoxin or neuromodulator treatment. So botulinum neurotoxin is the most frequently performed non-invasive cosmetic procedure in the United States. And so usually when you think about it, you kind of think, something looks fake, it looks overdone, you're like, oh, I don't want that. And usually you kind of think of the, most popular famous actresses, actors, things like that, like Joan Rivers, Madonna, Jennifer Coolidge. In one movie, in another Cinderella story in 2000s, she has this great quote, and I always thought about it and never wanted talks because of it. But today we're here to kind of bust some of those myths and expand our understanding so that it's a little less scary. So botulinum neurotoxin, it acts on our neuromuscular junction, and all that is in a muscle between nerves. We have the release of acetylcholine. And so what it does is it blocks that acetylcholine. That release across is what causes our muscle to contract. And so we prevent that muscle from contracting, which can help prevent deep wrinkles. And so a lot of people think it's just kind of cosmetic, but it actually has a lot of medical indications as well. Do you want to talk a little more about that?
Sure. So one thing I think a lot of people don't realize is that neurotoxins like Botox aren't only used cosmetically, they're also, used medically for different conditions. So certain conditions, so Botox has FDA approved uses for conditions like chronic migraines, excessive sweating, overactive bladder, things like that. And then of course, we use it for the cosmetic side. Most people are familiar with neurotoxin to soften forehead lines or your 11s, your angry face, crow's feet by the eyes from smiling too much, chin dimpling, lines around the mouth. We can also use it in certain areas to help with a gummy smile, jaw clenching, prominent neck bands. There's tons of uses for neurotoxins. So some brands. Of course, everyone knows Botox. Here at the Med Spa, we carry Botox, Dysport, and Zeman.
So kind of looking down anatomy-wise, if you kind of want to trace down the face, the areas that we most commonly do tox are usually our forehead lines across here when you raise your eyebrows, your 11s when you make an angry face in between. We also can do it around the eyebrows to give your eyebrows a lift, as well as when you smile. Around here for your crow's feet. You can do it up here for your bunny lines when you scrunch, as well as if you flare your nose a lot, we can kind of narrow that out. When you smile, sometimes people will get a pull down of their nose, and so you can inject under just to give that a little lift without doing a nose surgery. As well as for your gummy smile on the sides here, when you smile, that muscle pulls up, so we can bring that down a little bit. The other areas you can do across here, we call them smoker's lines or lipstick lines from constantly pouting. Mm-hmm. We always hate those lines. A big popular one on social media, I feel like nowadays, is the lip flip. It's not the same as filler, but man, it does the trick when you have a lip that tucks in when you smile, it brings that out. Masseters, huge one. This one I loved. So masseters are a big one. Kind of helps shape your face a little bit, especially for the square jawlined girlies out there. And then our chin, of course, our DAOs that help pull our chin or our lips down. So when we do those, we give a nice little perk up on our smile. And then our neckline to kind of tighten that jawline.
So there's always risks with neurotoxin, bleeding, bruising, infection. Like any injectable treatment, neurotoxin does have potential risks and side effects. So some of the most common that we talk about, minor bleeding at the site, nothing major, bruising, swelling, tenderness or redness. Infection is also a potential risk. It is rather rare. So if you have a wedding, vacation, photo shoot, or something really important coming up, I personally wouldn't schedule your first treatment right before it. Give yourself, some time beforehand, because bruising can happen and you don't want that in the photos. And definitely, tell your provider about all the medications and supplements you're on, especially anything that affects bleeding or clotting. And don't stop a prescribed medication just because you're getting Botox. Talk to your healthcare professionals.
Yeah, I feel like big ones on that would be like Eliquis, Coumadin,
Oh
like
yeah,
the big
absolutely.
anticoagulants.
It's gonna make you bleed.
Don't stop that, please. That would end so poorly. So how do we usually manage the, infection part? I feel like that's what most people would worry about because bleeding and bruising, they go away. Bleeding's pretty easy as long as you're not taking a bunch of anticoagulants before. But I think we usually just clean you up. Do you want to get into the myths?
We could start with the myths.
I feel like so she named the brands before. The biggest one I think I hear is that all neurotoxins are Botox. So people are like, oh, do you get Botox done? But there are so many different brands, between that, Dysport, Xeomin, Jeuveau, you name it. And so they all actually have the same core neurotoxin. They just differ in their formulations. They can differ in, potency, dosing, things like that. And so brand Botox became like the household name, but now there's actually some really good competitors in there. I've become fond of Xeomin personally. But the biggest thing with Botox or any kind of neurotoxins, please make sure you're getting it from, a medically licensed professional. You're getting, pure Botox, no counterfeit or unapproved types of Botox can increase risks with impurities. And then that's like the biggest one. You want to know what you're getting. The other thing, the biggest one I feel like in the myths, Botox will make me look fake. It'll make me look frozen. It'll make me look deformed. I can't smile. I can't do this. I can't do that. And so that's like one of the biggest myths I think we have to bust today because I hear that so often and they're like, well, I don't want to look fake. Me neither. But I don't think you can tell. Both of us have had it done. Do we look fake? And so that's one of the biggest ones. The key to that is honestly just having the right injector. So the right injector knows how to dose you and how to dose you properly. And so I feel like, when you get an injector that either isn't licensed or, maybe isn't as experienced, that risk can come of being frozen. But our goals are mainly just refreshed. You can still move. I'm moving my eyebrows right now. It's just without the wrinkles, which is nice. We were blessed. We got trained by a professional. Her name is Morgan Van Solkema. She's our lead injector, and she's a PA as well. And she trains for Skin Click, which is known to be the #1 training in the country. So we were kind of blessed there. And, we got to inject on several faces before we started offering it to our clients.
There is this myth, neurotoxin can prevent headaches. So actually, it's a little bit of yes and no. Botox is FDA approved for prevention of chronic migraines in appropriate patients. But that's a specific medical treatment using an established migraine protocol. This is very different from coming to a med spa and getting cosmetic Botox. So if someone happens to notice that they experience fewer headaches after cosmetic treatment, that's one thing, but we shouldn't be advertising regular cosmetic injections as a treatment for chronic migraines. Another myth, it's just for wrinkles. It isn't. Neurotoxin has a number of medical uses, and it can also be used cosmetically in areas people may not immediately think about, such as, excessive sweating and what else? Certain patterns of like jaw clenching.
Yeah, that's what I use for my masseters. So I didn't get migraines, but I get headaches up here because of like when I get stressed, I clench or chewing, and now it's all gone. It's so nice. I think where can you put it for the sweating? Usually I think the underarms and then even like your hands and your feet, although I imagine that one might hurt just
I don't know
a
about the
little.
hands, but definitely the underarms.
Yeah. Another big one is one dose fits all. If your friend tells you she got 20 units, that does not mean you need 20 units as well. Absolutely not true. So, our foreheads, for example, are all very different. If my forehead was twice the size of hers, I'm gonna need probably twice the Botox, and that's just the muscle size and the area I have to cover. You know, if she gets 20 units and I have twice the size, we're gonna need 40. And so I wouldn't have the expectation of coming in needing that, because then you're gonna kind of underdose yourself if you want that, and you might need more, or you might need less. You can overdo Botox certainly as well. Yeah, and then
Yeah,
yeah,
so I
go ahead.
think a lot of people think, oh, when I'm going to get Botox, I have to get my entire face done. That's not true. Everyone's different. You know, certain things bother certain people. We don't just do your entire face. We ask you, tell me what bothers you, and then we fix that. It could just be the forehead. You know, I do not like my 11s when I have them. That bothers me. So I usually will get, like, you know, from the nose up. Other people love the entire face. It's just different for everybody. You don't have to get the entire face done.
I feel like the question I get most often is like, well, what do I need? And I love
need
answering that.
anything.
You don't need anything.
That's what I say, yeah.
You don't need anything. I say, if it doesn't bother you, do not waste money on it. Don't spend it, because you won't see the difference. There's no point. Mine too. My 11s in my forehead bothered me for the longest time. And I always kind of had a square jawline. I feel like my masters have kind of slimmed down, gave me like a heart shape. I'm okay with that, but that kind of goes along with, you know, a lot of people think Botox, neurotoxin treatments are just for women, just for females. That is so not true. I feel like it's more a stigma around getting neurotoxin itself. There's been a new trend, although not widely advertised, called Brotox for the males out there. And we do have a lot of men come in for Botox. You know, it makes them look a little more relaxed, a little less stressed, a little less angry, especially up here. But they won't talk about it to their guy friends, right? Their guy friends can't tell, but they're not gonna go say, hey man, I just got Botox in my forehead. For example, my brother, he's going away for a job, and this line bothered him right here. And I was like, I can fix that for you. And I was like, we can do Botox or Xeomin. I offered him Xeomin, the brand. And he was unsure, and before he left, he did it. And so he's gonna send me after pictures in like the next week at his 2-week mark, but he said he's already loving it.
I'm sure he's gonna come back for more.
We're gonna go to break, but after we come back, we're gonna bust some more myths, okay? Sound good? I feel like we're
tuned.
Ghostbusters.
We
Stay
are.
tuned, yeah. Hi, welcome back to Bright Eyes Face Medspa. I'm Kaitlyn Roberts. I'm a physician associate aesthetic injector, and I'm here with...
Hi, I'm Tarin. I am an RN, and I am an aesthetic injector here at the spa as well.
Don't forget to follow us on our social medias. We have Instagram, Facebook, and I just learned TikTok. And then we're gonna start busting some more neurotoxin myths. So Botox, most commonly known, but Dysport, Xeomin, etc. And so a huge myth I think I'm gonna start with, if I start tox, I can never stop. I have to keep going or I will look worse. And that is so very much not true. So Botox itself, or Xeomin, Dysport, whichever brand you get, usually lasts on average 3 to 4 months, up to 6 months. And so once that kind of starts to wear off, you're just gonna have your normal muscle movement back again. And so, you know, you may actually have a little bit less initially. It may take more time to wear off completely, but you won't look off any worse off. You know, I feel like your muscles, they'll just start moving. You can start developing lines again. That's why I usually recommend maintenance dosing to kind of prevent that a little bit. But the other one is that I heard the other day, we did an event and I had someone come in and tell me, where can they get it done? And I was explaining it and they said, oh, I thought I could only get it from like my cheeks up. And I said, what? Who said you could only get your Botox from your cheeks up? And she said, oh, my other injector. She went to a dermatologist's office, to this licensed injector, and he told her she could only get it from the cheeks up. And
Oh, wow.
I feel like that's such a disservice to her because there's so many important areas down here to prevent jowling and to prevent, you know, those marionette lines down here, you know, when you do these muscles here and your mentalis and your masseters, your platysma, to prevent like that pull down.
Yeah.
And so she was so shocked, and we ended up doing her whole face and she loved it. It was nuts.
Earned yourself a new client. Yeah, so I think one of the myths that everybody may think of is neurotoxin permanently changes your face or makes you look older. I mean, no, it doesn't. The effects of neurotoxin are temporary. As the effects gradually wear off, your muscles start to move again. There's a little more to the story, though. I know, I do wish it was permanent. But when we repeatedly decrease the activity of a muscle over the time, the muscle can sometimes become smaller or less bulky. So a really easy example is the masseters, which are the large chewing muscles along the sides of your jaw. For someone with very prominent masseter muscles, treating them repeatedly can sometimes slim the appearance. I love that look.
Mine too.
So that's why anatomy matters, and it's also really important why you choose the right injector, because you don't want, anybody just saying, yeah, I'll put it wherever you want. You want somebody that knows what it's going to do to your face and how it's going to make you look,
I don't get mine every time. I get every other because I don't need it every time.
Yeah, exactly. Neurotoxin does not work immediately.
Common misconception.
Some people think that it does work immediately, and it doesn't. It often takes 3 to 7 days to see a little change. It fully sets in 2 weeks. Sometimes you could have some asymmetry before it sets in, so people are like, it didn't work, my face is all uneven. But no, give it the full 2 weeks and you should see great results. Peak effect after 4 to 6 weeks. Typically, it should last 3 to 4 months, but it depends on your muscles. If you're using them more, especially for lip flips, they don't last as long because you're talking a lot.
Yeah, the more you move it, it's not going to last as long. Meanwhile, our forehead will last so much longer.
Exactly.
I usually tell people, I do not want to hear about your results until 2 weeks. Give me a full 2 weeks and your faith. I promise you will love them. Yeah, I think the other one is dosing and units. So kind of along with, dosing and different brands, it's important to know that not all dosing is the same. And so if you go to somewhere and they have different brands, Botox, Xeomin, Dysport, they should not all cost the same necessarily. So Botox and Xeomin, they're actually pretty similar in dosing. So if it's like, $9, $10, $13 a unit each, then that's pretty fair. But if they're going to give you Dysport and they tell you it's $13 a unit, do not go there. That is a ripoff. So Dysport, the way it is dosed, it is about a 2.5 to 3 to 1 ratio. So like a 3 to 1 ratio to Botox or Xeomin. And so if I get 5 units of Botox in my face somewhere, it's needing 15 units of Dysport. And so you're going to be paying a disproportionately larger amount of money if it costs the same. It should be a third of the price or half of the price to kind of be even.
Coming into, the aesthetics community, I never knew that it was like that until, we learned about it, and it's a big misconception and rip off.
It is, yeah. I didn't know that either. I would have went in and been like, okay, but if you didn't get the other one, you would have been like, wow, it's just that expensive. The other big one I think is neurotoxin prevents all wrinkles. So you get one treatment and then you're like, all my wrinkles are gone. That is very not true. I'm sorry to say, I wish. And so when you do the injections, it's actually used for dynamic wrinkles. So the wrinkles when we move our muscles and then we wrinkle, that's what Botox can help resolve. But if we at resting kind of have that deep line up here, or we have a chin line from puckering or lifting our chin up, Botox will not resolve that on its own. It can soften it tremendously and prevent it from getting worse. Sorry, lost my English. But usually what you need is a combination of really good skincare. Usually that can include a retinol that can help with some skin turnover, microneedling, which helps promote a lot of collagen and elastin, making our skin tighter, firmer, shinier. That combination is beautiful. I will recommend it to everyone, and I will go to my grave with it.
Yes.
but usually that combination and SPF. Nobody waste your money on anything we are giving unless you're going to put sunscreen on. It will waste your money. The sun is the #1 cause of damage and aging and wrinkles. It is not worth it to do anything if you're not going to take care of your skin. Yeah.
All right. So,
Got another?
another myth, Botox hurts a lot. I can relate to this because when it comes to needles, I'm a wimp. But you know what? Like, it really doesn't. We give you a beauty bar, which vibrates, and you could put it on a bone. And it takes away the pain. The needles are so tiny, you could barely feel it. And I was nervous going into getting my first treatment, and I'm like, wow, that's it? It's amazing.
Oh, you did better than I did. I still was like, ouch.
Oh, no.
It's not bad. It's an insulin needle. That vibrating tool helped so much more than I thought it would. I think most of it was my brain. I think one of the other ones, I get this one all the time. Okay, I want Botox and I hate these. These are nasolabial folds, and they say, so I want Botox, I want you to do this. And they lift their face up, and I'm like, okay, this is not gonna happen with Botox. We have to be realistic about our limitations, because if not, we're gonna set expectations that can't be met, and then everyone gets disappointed. So Botox and filler, or neurotoxins and filler, are not the same thing. Botox, it works on our local muscles, freezes them, prevents them from contracting, forming wrinkles. Filler adds volume, adds plumpness, and so oftentimes when we get these nasolabial folds, they are usually due to the loss of these fat pads in here in our cheeks. So when we're babies and we have this nice plump fat pad, as we get older, they start to thin, especially if you lose weight and things like that. And so that skin just kind of droops a little. Now, that being said, that with jowling, you can do Botox to kind of help prevent worsening of jowling and things like that. But that lift that people want is usually, it needs either plastic surgery, like a facelift, or it needs some filler in this upper cheek area to kind of give you that boost. Yeah. Gotta set that expectation early.
A lot of people are like, can we get rid of these?
Not with Botox.
Neurotoxin can change your eyebrow shape. That is true. Muscles in your forehead and around your eyes and eyebrows, they all work together. Some of them help lift the brows while others pull them down. So it's really important that you have a good injector that knows the anatomy and knows how, high to inject and where not to inject. Anatomy is very important.
I think it's awesome. I mean, I have people come in with like heavy lids and they don't want surgery. And so I'm like, okay, I can't fix that. Excess skin needs to be surgically replaced, right? But we can give them a nice lift. And so by kind of usually hitting this area that pulls down, we'll relax that. And then around here on our orbicularis, we can kind of lift that up a little. We give them this almost nice lift and refreshed feeling without them having to go under the knife, which is beautiful. One of the other ones, neurotoxins or Botox, it will stop working if you use it too often. So this one's kind of interesting. I can't say it's false or it's true. I feel like a little bit of both. This one I gotta dive into. So it's not common, right? If you use it chronically, most respond still very well to the same amount. But because the formulation is different and the potencies are different, over time, certain neurotoxins that have proteins around them, you can develop antibodies to, and so resistance. And so that means that with the antibodies and that resistance, you may require a higher dose to have the same results. It's not as common. I did see one woman who's been getting it for like 40 years, and she had to get more and more every time. And so the injector she was going to is definitely making a lot of money, but sure. I mean, no one wants to pay more for their tox over time. That's why I like Xeomin. So Xeomin's a pure botulinum toxin without a complex protein. So in theory, it doesn't, actually develop antibodies. And so, you might actually need less over time and to spend less if you're consistent with it because of making that muscle a little smaller with consistent use. It's all in theory, of course. They still have yet to do all the studies on it.
It's my go-to, though.
Mine too. I won't put anything else in my face.
I think the final question is, should you get neurotoxin?
I think that's a very good question. There's no one size fits all to this question. It's either, it has to be right for you. So you have to take into account things like your anatomy and your goals, your preferences, definitely budget. And honestly, does it bother you? You know, there's nothing wrong with the natural aging process. It's beautiful. And I don't think anyone should feel the need to have to get any kind of neurotoxin injections. Our goal isn't really to change who you are. We just want you to feel a lot more refreshed, feel more confident, feel like you.
Absolutely.
And look like you. And so our goal is to kind of make it almost very conspicuous. No one can tell. And so if you want it, if you got questions, come talk to us. We'd be happy to answer them, tell you, you know, if we can help certain things that bother you. But if not, I think it's fantastic however anyone would like to age gracefully.
Exactly.
Thank you today for joining us at Bright Eyes and Face Medspa. If you have any further questions, feel free to give us a call. We'll put the number down below. I've always wanted to do that. You can also feel free to come into a complimentary consultation at our Tannersville location or our Hazleton location. Yeah.
Yeah, thank you so much. We'll see you soon.